we proceed with Ms. Eliana Ipsis, who is a cardiovascular perfusionist, to briefly talk about the experience of ECMO in the Middle East.
Ipsis from Maquet, Middle East. Now we're called Gettinga Group. Most of the only product we use is the Cardio Help when it comes to ECMO. So I want to talk a little bit about who we are, where we come from, and what we have seen in the Middle East thus far. So Maquet is in Rastatt, Germany. This is where our main headquarters is. We are 3 teams into one. So the Gettinga Group is with Arjo Huntley, who does our our beds and DVTs. Gettinga Group does the infection control, and Maquet Middle East does the cardiovascular equipment. So to cover the Cardio Help itself, the Cardio Help can be used anywhere. It can be used in the ICU, the cath lab, the operating room, and as you saw with Dr. Nick, you can see it, we can be transporting patients with it. It has 5 different therapies on it. We have venous ECMO, veno-arterial ECMO. We can do open heart surgery with it, and coming soon we will have the pump assist lung protection. This is for CO2 removal. This is going to be coming hopefully in the very near future. We also have a ventricular assist device, a short term. All of these, except for the MAC system, which is the open heart surgery system, can be used for 30 days continuously. In the Middle East, we have covered almost every single country. We are covering 16 countries. This is including Pakistan and Afghanistan. We currently just had the first ECMO case successful weaning off in Pakistan 3 weeks ago. So, here, our commitment in Gettinga Group is to do trainings. We do on-site trainings, we do international trainings, and we also will stay with you until the patient comes weaned off. So our reference centers, we have multiple reference centers throughout Europe. We have on-site trainings and the ECLS guideline. The ECLS guideline will cover indications, contraindications, how to pick out the different types of cannulas, what are you looking for in terms of labs. Our first reference center is in Milan, Italy. This is in San Rafael Hospital. We usually send intensivists, cardiologists, cardiothoracic surgeons, and perfusionists to see live cases. It's a very, very busy center, and they use our ECMO quite a lot there. Our second center is San Antonius Hospital in the Netherlands. They do 980 cases of open heart a year, and this is including ECMO as well. On-site trainings. There's 3 of us. I am the perfusionist in the group. And as you can see, I have been to Kuwait. So you do have our Cardio Help here. So there is currently 4 Cardio Helps throughout Kuwait, and they're running quite often. So these are things that we need to start looking at. How do we increase our survival rate on ECMO? What do we need? Dr. Nick talked about having a team. This is the most important thing. The ECLS guideline shows us the priming and setting up, cannulation sizes, indications, contraindications. These are extremely important things to have with you at all times. And finally, we also provide continuous studies to the people who are running ECMO. That way we're continuously learning and educating throughout the Middle East. Clinical support. Throughout every case that we start with the ECMO, we are there for the first case. We try to be there. When we are looking at the cases, one of our biggest breakouts that we had in the Middle East is the coronavirus in 2014. This was a huge problem in Saudi Arabia, and it did spread here to Kuwait. The first case was done in Dabus Hospital, and it was a corona patient who was on for 18 days. He did survive. He was weaned off of ECMO. It did make it also into the political news. So this is very important that we start seeing and helping the patients of Kuwait as well. The first case in Egypt, Cairo, Egypt, was an H1N1 patient. He is a doctor, a cardiologist, who got H1N1 from a patient. When I went down, it was complete white lungs. This was day 11 that you see the white lungs here. On day 22, he was weaned off, and he was discharged, and he did go home. He was a very young doctor, so we wish him all the best. The most recent case I did was in South Africa. This is a very interesting case report. The patient was 48 kilos and 176 centimeters. So you can only imagine how skinny this kid was. 25 years old with cardiomyopathy. What we want to look at here is the lactic acid was at 11 and his ejection fracture was at 15%. The first thing they did, they put an intra-aortic balloon pump into the patient. Then they saw that this was a VA patient. So they went ahead and put him on veno-arterial ECMO. This is the most common way to cannulate. This is the most common way to cannulate, and he was on full support. What he had was his aortic valve was completely shut. There was no way of his aortic valve to open, so he started getting hypertrophy inside the left ventricle, which led to a positive feedback, which caused pulmonary congestion. So that caused a feedback again and destroyed the right ventricle as well. So what we did is that we put in an LVAD. The patient was on ECMO while we were putting in the LVAD. We weaned off of ECMO for exactly 50 minutes as the LVAD went in, kept recirculating the ECMO. So as you can see here, we kept recirculating. This was when the ECMO was off on standby. The patient has been weaned off, and he was put on right heart support during the case. He was cannulated in the pulmonary artery, and we kept in the venous femoral cannula. So he was weaned off on December 5th, and now he's slowly being weaned off the ventilators. He did survive, and every time this kid woke up, how bad his muscle capacity was in his body, whenever he got up from sedation, his SVO2 levels just plummeted. We went from 78% down to 51% on SVO2. He had no muscle mass in his body. He was a very sick kid.
Summary, please.
So it was very good to be able to help him. I skip a little further. With getting a group, next year we will be having the SWAC ELSO. This will be in Doha, and also Euro ELSO in the Netherlands. So, in conclusion, the CardioHelp has saved many lives throughout the Middle East. This is an excellent product for transporting patients, being able to have patients roll around in the hospital and be awake and walking around. And finally, we provide the guideline as well. Thank you very much.